Welcome back to the Rock Your Retirement Show. I'm your host, Kathy Klein, and today is the fourth episode in a series of 4 with my husband, Les. Say hello, Les.
Hi. Hello, Les. Oh, no.
Hi, Gracie. Where we are talking about chronic pain. I mean, the article that we are referring to is in the Consumer Reports June 2019 magazine, and it was a pretty long article. That's why we didn't want to do it all in one episode. And so we will be finishing that up today, and we'll be talking about steroids and surgeries. But before we start, I wanted to let you know that this episode is brought to you by Medicare Quick, and we're not promoting the step-by-step guide today. We're promoting the classes. So I have a class site where you can watch for free 30 episodes, 30 different videos, 30 different classes. Actually, they're not all videos, but most of them are on different topics of Medicare. The first lesson is completely free. In other words, you don't have to put in your email address. You can just get it for free. And then if you want to watch additional episodes of the, different classes, then all you have to do is put in your email address. And don't worry, I'm not going to spam you. I am not going to sell your information to anybody. You're not going to get 20 phone calls. If you decide that you want to work with us, and we are not going to call you because you gave us your email, then it will be me or a member of my team that will contact you. If you are within about 8 months of turning 65, you're probably already getting that huge stack of Medicare mail. It usually winds up being about 6 inches, 4 to 6 inches. Don't worry, we're not going to add to that. We just want to make sure that you have all of the information that you need when it comes to Medicare. So thank you so much, Les, for joining me once again and talking about pain and actually bringing to my attention this Consumer Report article. So what did you think about steroids? I mean, I definitely know people who have done both steroids and surgeries, and it does provide relief to them. Although I believe that it said in the article that steroids do tend to go down depending, like you can't overuse them. But it talked about how when this particular gentleman went to go see a surgeon, that basically the surgeon said, you got to have surgery. And they went and got a second opinion and wound up they didn't need surgery. It's kind of like if all you have is a hammer, everything looks like a nail. Did you get that impression?
Yeah, well, I feel that way about surgery generally anyway. I mean, I think you always have to have a second opinion, in my opinion. And the article says that orthopedic surgery in particular has more people seeking second opinions than any other specialty. And so that just says that the body has a capability to heal itself a lot of times, that you don't need to have surgery to heal the problem.
Well, I'm going to bring up a story that I've brought up. I don't know if I brought it up on the show before, but I've certainly brought it up with our friends. And let me preface this that I don't equate animals to people, okay? But I had a dog years ago. His name was Barney. And Barney hurt I think it was his hip. And this was before I knew Les, but Les did get the opportunity to meet my dog. And I was not making a lot of money at the time, and took my dog to a vet, and the vet said that my dog needed surgery. And he said that there were risks involved with the surgery, and that the surgery it was going to take him 4 to 6 weeks to heal after the surgery. And the surgery was going to be $5,000. And I said to the vet, I said, well, how long will it take my dog to heal if I opt out of the surgery? And the vet says, it'll take 4 to 6 weeks for your dog to heal if you don't have surgery. And I looked at the vet and I said, if it's going to take 4 to 6 weeks for my dog to heal after the surgery, and it's going to take 4 to 6 weeks for my dog to heal if he doesn't have the surgery, why would I put my dog through going under anesthesia, going through all of that pain of the surgery, and spending $5,000 when it's going to take the same amount of time to heal? And I kid you not, that vet looked me straight in the face and said, well, that's your choice. And so after that experience with my dog, I always ask questions. I mean, when we first found out that Les had cancer, didn't I want to ask about 1 million questions to the doctor?
Yeah. That's reasonable.
And
that's
a lot of those
reasonable.
questions listener, my husband would not let me ask this, but I wanted to ask the doctor how much money he was going to make by putting my husband through chemo. Les, being the kind soul that he is, would not let me ask that question, but I certainly wanted to ask.
Well, I mean, doctors do, especially these days, get paid for doing what they normally do, and that is surgeons get paid for surgery. Of course, they're going to want to cut you.
Well, we know somebody who had surgery and he wound up with MRSA.
Yeah, sure. I mean,
and now he has a lifetime problem.
Yeah, there are side effects of surgery, just like there are side effects of drugs. And in any case, it just says that you should always try to get a second opinion when you have pain. We're talking about chronic pain here. When you have chronic pain, get a second opinion and see if you can maybe avoid surgery.
But sometimes surgery is what you really need. I mean, I had a business partner and she had incredible neck pain, just incredible neck pain. And it went on for years and years. She wound up getting a fusion and it cured her of her pain.
Sure.
So for her, the surgery was definitely the right way to go. But the point is that she tried so many things before she resorted to surgery because it is very invasive and you don't know if you're going to wind up with something like MRSA. And I'm not saying that you shouldn't have surgery again. I'm not a doctor and neither is Les. We are just discussing this article. Any thing that you decide that you want to do for your pain, if you are receiving pain, that is a discussion between you and your doctor.
That's right. That particular case that you mentioned was back surgery too.
Right.
With the MRSA. Yeah.
Oh, that's right. It was, wasn't it?
Yeah, it was back surgery.
Yeah.
That just says, I mean, anytime you go under the anesthesia, anytime you go to the hospital, you run the risk of having complications. There's no question about it.
That's why I like staying away from emergency rooms and hospitals if I can.
Yeah.
I like taking advantage of the video doctors.
But the story that this guy had a what was it, a slip disc, I think.
Herniated slip discs. That's right.
That he was able to cure that with
physical therapy.
Physical therapy, which is really great. I mean, this is exactly what you want.
And exercise, I must say. It wasn't just physical therapy.
But the other side of it was hard work on his part.
Right. He had to do the therapy and he had to exercise.
Yeah. He just didn't go in there, have some anesthesia, get some surgery, and everything was fine. I mean, it was hard work, but it paid off because he's not had problems apparently.
Right. Yeah, it's hard. Now, this surgeon, orthopedic spine surgeon at Swedish Medical Center in Seattle, his name is Hanskorn. He starts with what he calls prehab. And so before he does surgery, he works with them on sleep, which we've already talked about, I think, in episode 1 or 2. Stress, which we really haven't talked about.
No, we haven't.
And exercise, which we talked a little bit about. The stress thing too, stress can definitely cause pain. I know that when I get my shoulder pain, it's usually because I'm under a lot of stress.
Yeah, because stress causes inflammation and inflammation causes pain. So, yeah, I have the same issue. If I'm under a lot of pressure, my neck hurts. Same kind of thing.
Yeah.
So
before you get surgery, a lot of people start with cortisone shots.
That's right.
And I know a lot of people that get great relief from cortisone, but after a while it stops working.
Right. But that comes to the steroid injections.
Right.
Now, I have, when going through chemo, they give you steroids right at the beginning of the chemo treatment.
But they're not giving you shots. They're giving you pills so that you can keep up your energy.
Right.
That's different. I mean, they're not giving you steroids for pain. They're giving it.
Yeah, different reason. But, I know what steroids can do from a positive standpoint. It really did, in fact, help me have more energy and overcome what could have been a lot worse on the chemo.
Right. Remember, we used to jokingly ask if you could just have steroids every day.
Yeah, right.
Right. And the doctor said, no, you only get them before this, before
3 days, So, but in any case. But one of the things that they talk about with direct injections of steroids is, depends on where the injection goes, you can actually cause somebody to die if you're putting it in the wrong space in your back.
Well, isn't it usually the actual doctor who gives you the steroid, the cortisone or the steroid shot? It's not usually a nurse.
Yeah, but even so, I mean, the complications are incredible. I mean, they're talking about the epidural space outside the sac of the fluid around the spinal cord, which is where a lot of people have problems with. But if they make that injection in the wrong place.
Right. They said that it's actually safer to put it in your buttocks. Yeah.
Which is a secondary effect of problems with the back. Oftentimes is pinched nerve that I was talking about in the last session.
Right. And a lot of people do get, I guess that's where the term pain in the
butt. Yeah. Pain in the butt.
Oh.
That's right. That's right.
From.
But I can see where injections in the buttocks or in the legs could make sciatica less painful, no question.
I've never had a shot for pain, personally.
Me neither, actually.
Yeah, I've never, but I know plenty of people that do, and plenty of people that have chronic pain. It just, my heart goes out to them that they have to.
Yeah, sure.
That they have to do this and can't really function between shots. But this says that more than 2 or 3 shots a year can cause joint cartilage damage.
Mm-hmm.
And I don't know if it's eating away at the joint, because if you're getting a shot in your butt, and it's causing joint damage, I wonder how that happens. I wonder why. It must somehow cause nutrients.
There's some physiological reason for it. There's no question. But what it is, I don't know.
But I have another friend who is in chronic pain, and she gets surgery, and then 3 weeks later, she's on an airplane. That's
going
another somewhere. She's not doing what the doctor tells her to do. Well, I just find that to be, sometimes I just want to say to her, hey, you've had multiple surgeries. Why don't you just stop traveling for a while and take some time and heal like the doctor told you to do?
Yeah, that's right.
So it's frustrating being the friend of somebody who is not following the doctor's instructions, because although pain is personal, each person's pain is personal, as an outsider, sometimes you just want to say, hey, why don't you do what the doctor tells you to do? Just take some time, take a deep breath, take 8 weeks off or whatever the doctor said, and stop trying to do so much, because you're not doing yourself. Okay, I'll give you an example that has nothing to do with one of my friends. Les and I just started watching that show, This Is Us. And we are late to the game. It's, we're currently on the beginning of season 3? Les?
I think so, yeah.
We're currently on the beginning of season 3, and we're recording this episode in May of 2019. So we're far behind. Please don't tell us what happens. But in one of the I think it was last season, season 2, what's the movie star's name? Kevin? Is that Kevin?
Yeah, I don't.
The son, I think his name is Kevin. He
Yeah.
hurt his knee and refused to stay off of his knee. And the whole time I'm thinking, you dummy, do what the doctor says. You're gonna cause yourself a lifetime disability. That's what I'm thinking. I'm not thinking,
Yeah,
oh, he's a tough guy.
yeah. No, in this case, pay attention to your physical therapist, because you need to move the knee, but you can't overdo
it. Right.
And so that's where I think your other friend might really benefit by following to the letter a physical therapist.
It's hard when, and then you get to hear all the complaints and what's going on, but you as an outsider are not allowed to say,
no.
Hey,
find a physical therapist.
Hey, you need to start doing what your doctor is telling you. You're not allowed to do that. I mean, that is socially unacceptable for sure. You won't have many friends if you do that.
But the character Kevin in
did I say Keith?
Series.
Yeah, it's Kevin.
No, Kevin. Yeah, he chose to go the opioid route,
and then he became addicted. Right.
So, guess what? His knee didn't heal. So it's what so many people end up doing.
Right.
It's
our society. Our society kind of trains us. Take a pill, take a chill pill. We have it in our vernacular.
Now, as an example, the article talks about the fact that orthoscopic surgeries on the knee to repair cartilage. It's one of the most common surgeries, but it's pretty ineffective when it comes to pain, apparently.
Did it say that?
Yeah.
I guess I remember reading about hip replacements, that is a good surgery, that there's a high likelihood of being out of pain. Where is that? Yes. I don't even know where that is.
It's right at the other options. Are there other options? Studies have shown that they don't improve symptoms any better than physical therapy.
But sometimes it does.
Yeah, like hip surgery is an example.
Right. It says, you're right. It says surgery does not necessarily lead to better results and safer treatments.
Yep.
Orthoscopic knee procedures to repair cartilage are among the most common surgeries in the U.S., yet studies have shown that they don't improve symptoms any better than physical therapy. Exercise and physical therapy work as well or better than surgery for minor rotator cuff injuries and low back pain. But it does say that surgery may speed recovery from a slipped disc or spinal stenosis, but those using non-invasive therapies for at least 2 years failed just as well. But who wants to go through 2 years of pain?
Yeah, well, that's true. But they say at the end that people who fully commit to rehab tend to have the best outcome.
But for 2 years.
I know. Well, that's your trade-off.
Yeah, it says 90% of people who have a hip replacement are pain-free 10 to 15 years later. Knee replacements improve mobility, but about 20% of recipients have ongoing pain. So I guess the moral of the pain story is, number one, everybody's pain is personal.
Yep.
Number two, multiple therapies work better than just one.
Yep.
And number three, if it gets bad enough, depending on the type of pain and where you're having your pain, surgery may help.
Right.
So that's kind of what I learned. What did you learn?
Yeah, I learned about the same thing. I learned, I'm not sure that this is just from this article, but I learned how important the physical therapy side can be. That's really, especially as you get older.
So the next time you're complaining about your pain, and I'm going to say, which I did last time, go get a
Yeah,
physical therapist. You might actually do it. There's one right around the corner from our house.
yeah, true.
You could
Yeah,
go
that's
knock on
true.
the door.
Well, it's
Hey,
tough to do because I really, just like most people, I really dislike the exercise. I mean, I really, it's boring and painful, but it's something I should be doing. I mean, there's no question about it.
well, we're going to talk about what we've been doing because we have been lifting weights, and not in
Yeah,
this episode, but we'll talk about it in follow-up episode
yeah,
about some of the movement things that we've been doing since we moved here. And the episode that we had with Rocky Lalvani really sort of kick-started us wanting to get healthier and lift weights. So we will talk about that in a future episode. So, Les, anything that you want to say before we say goodbye?
Well, I think it's been a big pleasure for me to join you in this podcast series. I look forward to others in the future.
Great. Well, thanks so much for joining me. I really appreciate it. And it's been a great fun for us to do this together. And for the listener, thank you for joining us. And we'll see you next time on Rock Your Retirement.